Hi everyone, my name is Natalia Snizek and I am in Miss Foley's Nutrition 2202 course at the University of Memphis. I chose to do my presentation today on fetal alcohol syndrome. I will be discussing what it is and how to prevent it. I want to start off by explaining the medical definition of fetal alcohol syndrome. As defined by Mayo Clinic, a nonprofit academic medical center known for their clinical studies, they stated fetal alcohol syndrome is a condition in a child that results from alcohol exposure during the mother's pregnancy. Now, even though there are some people who understand medical jargon, here is a translation for the definition I just read, given by my words. During a pregnancy, if a mother bearing the child consumes a large amount of alcohol, the fetus can develop a disorder known as fetal alcohol syndrome, also known as FAS, which is what I'm going to be referring to during this video. Now that we know what FAS means, what causes it? First, I find it important to understand how digestion works in a pregnant mother. When a mother consumes any kind of food or drinks any kinds of drinks, her body will digest it through her digestive system. It will go through her bloodstream, all the excess, and any of that, whatever is in the bloodstream, any food particles or drinks, nutritional items, will go towards the fetus via the placenta and the umbilical cord. And as you can see in this photo, the red line is the umbilical cord. It's connected to the placenta, which is not shown in the image, but it goes towards the fetus. So anything the mother eats, the baby will also get via the bloodstream with the placenta and the umbilical cord. So when a mother drinks alcohol during her pregnancy, it doesn't matter if it's beer, if it's hard liquor, or even wine. It will all pass through her bloodstream and go through the fetus's umbilical cord, where the fetus will also digest what the mother is drinking. This is why I really like this diagram. It shows you how when the mother consumes the drink, it goes through her bloodstream, through her body, into the placenta, which is number 2. And in that placenta, it will go through the umbilical cord and into the fetus. So it's just as if the child is drinking the alcohol itself. It is important to understand that while a woman may be able to tolerate a low dosage of alcohol, a fetus is unable to do so because of its small size. Alcohol is considered a teratogen for fetuses. Teratogens are substances that can cause problems in fetuses. Any dose of alcohol is worthy of harming the fetus. The best way I can explain this is how a person with a smaller BMI is less tolerant to alcohol than someone that has a higher BMI. And as you can see in this image here, it shows how small a fetus is compared to the amount of alcohol that an adult-sized human consumes. So even a small amount is toxic for this tiny little fetus. Just as I mentioned in the slides before, the amount of alcohol someone tolerates mainly depends on their size. Let's say an adult intakes more alcohol than their body can tolerate. We can see them start slurring their words, memories can't be formed correctly, and even irregular breathing, and many other more symptoms that come with alcohol intake. Now, I want you to imagine that on a very small and not fully developed fetus that just got a lethal amount of alcohol in their system. The alcohol can start killing their developing cells, the alcohol can interfere with their brain development, and the alcohol can even constrict their blood flow, which all leads to very bad things for the fetus. Alcohol intake in the womb not only affects the inside of someone's body by killing their developing cells and hurting their organs, there are also physical signs that come with it. Many children that have FAS are characterized with having small heads, small eye openings, a low nasal bridge, flat midface, a smooth philtrum, which is the upper lip, it's just smooth, there's no cupid's bow there, and a thin upper lip. And this is all because of how I just mentioned, alcohol kills developmental cells. Those cells have been killed when the mother intakes alcohol and it goes into the fetus. They've been killed and they were not able to fully develop those certain parts of the body. And there are many different types of symptoms that can occur in children with FAS. In infants, you're more likely to see little children with low body weight, they have a short height, they can develop sleeping difficulties, they most likely have a smaller head size, and they develop vision and hearing problems with many other more problems to add on to the list. In their early childhood, parents can start seeing their children have delayed speech, difficulty concentrating, hyperactivity, low IQ, poor school performance, poor short-term memory, and many, many other problems. And this mainly has to do with the alcohol's effect on brain development, as when alcohol enters the fetus's system, it lowers their brain development and it can make it hard for them to have better speech in the future, have higher intelligence, or just memory skills. So how can you diagnose fetal alcohol syndrome? Well, it's hard to diagnose. Many healthcare professionals will ask mothers about their drinking patterns during their pregnancy, if they had high intakes of alcohol or not. However, many mothers are not as honest, so they could watch the child to see if they have developed any characteristics of FAS, because many mothers just aren't as honest and it can be hard to tell from what they say, so they just monitor the child to see if they've developed any symptoms. Since it is hard to diagnose a child with FAS, it can be hard to find treatment. There is currently no treatment that is available for children with fetal alcohol syndrome. However, there are interventions that can be used to lessen the impact of the symptoms. Some of these interventions include talking to a healthcare professional about more of their health conditions and to see if they can help. Like some children may need hearing aids or even heart medication. Or talking to special services, as they can help with the future needs of children. Some children will develop behavioral issues, and enrolling them in special services classes, as in special ed classes, can help them with those problems. Or going to early intervention services, as they can help children with their social skills, walking skills, and even talking skills, as some children with FAS have such problems. Finally, visiting a mental health services. This is not only helpful for the child, but also for the parents, as it can be hard for them to cope with such hard conditions in their home, and the whole family going can just help in general. So, how can you prevent it? The only way that you can prevent fetal alcohol syndrome is by not drinking while pregnant. It is very important to understand that alcohol can harm, and just not drinking during this vital time of your life is important, as it can cause future problems to not only you, but to your child. And that is not a risk worth taking. So I'm just going to say it again. Don't drink while pregnant. I just want to thank you all for your time, and I hope you all learned a little something new about fetal alcohol syndrome and why it is vital for you not to drink while pregnant. Thank you so much, and don't drink while pregnant.